Prepared for tomorrow, no?
If people are able to come on the video, that will be very nice. Yeah, thank you, Don Lakshmi and others. If you are able to come on the video, that will be great. As far as possible, please come on the video. Yes, team. Kindly come on the video. Yeah, Rupika, you can start. Rupika?
Sir.
Yeah, today we will start the session with a systematic relaxation exercise. This kind of exercise we have to train to people whether they are having OCD or PTSD or whatever may be the issue. We have to give this to people. Okay. So Rupika, please go ahead.
Okay, sir. Sit straight. Close your eyes. Hands on your thighs. Slowly breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Feel the oxygen all over your head. Breathe out. Breathe in. Feel the oxygen all over your body. Breathe out. Breathe in. Breathe out. Now, give your attention to your feet. Your feet is relaxed. Your feet is relaxed. Your feet is relaxed. Now, give your attention to your calf muscles. Your calf muscles are relaxed. Your calf muscles are relaxed.
That's it, just run. Chris going on?
Your calf muscles are relaxed. Now, give your attention to your thighs. Your thighs are relaxed. Your thighs are relaxed. Your thighs are relaxed. Now, give your attention to your stomach. Your stomach is relaxed. Your stomach is relaxed. Your stomach is relaxed. Now, give your attention to your chest. Your chest is relaxed. Your chest is relaxed. Your chest is relaxed. Now, give your attention to your hands and shoulders. Your hands and shoulders are relaxed. Your hands and shoulders are relaxed. Your hands and shoulders are relaxed. Now, give your attention to your neck. Your neck is relaxed. Your neck is relaxed. Your neck is relaxed. Now, give your attention to your facial muscles. Your facial muscles are relaxed. Your facial muscles are relaxed. Your facial muscles are relaxed. Now, your whole body is relaxed. Relax. 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 Now, hear the sound in your surroundings. Feel where you are sitting. Remember the outfit you're wearing. When you're comfortable, slowly open your eyes.
So that was a really wonderful. That's really wonderful. Okay, so we will go into the case study. Okay, so we will be seeing case study pertaining to obsessive compulsive disorder. Okay, OCD. So in OCD, there are two words. One is obsession, one is compulsion. Obsession means the client gets a irresistible feeling to do something, either washing their hands. Let us take washing. Okay. So one client actually, the moment someone touches him or he touches someone, he feels his body is got germs. So immediately what he will do is he will try to wash his hands. He will try to wash his hands many times. So he will, when anybody gets the obsession that I have to wash my hands, I have to wash my hands, I have to wash my hands, that is called obsession. When the obsession leads to the behavior, that is, the thought is wash, wash, wash. So you start washing. The moment you start washing, that is called compulsion. That is, you are giving way to the behavior. So obsession is a thought which makes you do something, which you feel that you have to do it. Unless and until you do it, you become you are not okay. Like that you feel. And the compulsion is when you start doing. So the OCD cycle. The OCD cycle is, first we will get the obsession. The obsession will lead to your anxiety. The anxiety will lead to compulsion. The compulsion will lead to temporary relief. A temporary relief. After the temporary relief is over, again the obsession continues. So this is what the OCD cycle. So usually OCD we use a what you call a checklist. Okay, this is called a box checklist. Okay, so this checklist we use try to find out whether the client is having OCD. For example, this is the checklist. So this is the checklist. So here it is called a Y box questionnaire. There are total you have 10 items. You have 10 items. The client has to tick any one. For example, let us take one. How much of an effort do you make to resist the compulsion? The compulsion is coming. Okay. That I have to do it. I have to do it. Okay. Always try to resist. 0. Try to resist most of the time. 1. Make some effort to resist. 2. Yield to almost all compulsions without attempting to control them, but with some reluctance. 3. Completely and willingly yield to all compulsions. That is 4. So they will score the amount here. So there are total 10. If the score is more, that means they are having the OCD more. So the more the aspect, the more compulsions. Please don't do all these things, team. Okay. One second. So this is Y box checklist. So in Y box, there is one more column. If you come down, so you have one is different types of obsessions. Okay, aggressive obsessions, contamination obsessions. Okay, sexual obsessions, hoarding and saving obsessions, religious obsession, obsession with the need for symmetry or exactness, miscellaneous obsessions, and somatic obsessions, cleaning, washing compulsions, and checking compulsions, and repeating rituals obsessions, counting compulsions, and ordering and arranging compulsions. So here they'll be writing whether this pertains to current, this pertains to past. Okay. So what is that it applies to you, that you have to take it. Whether suppose for example, if you are having current, you will put a tick mark. If you had it in the past, you will put the tick mark. So this will give an idea what kind of obsessions or compulsion a person is having. So for OCD, we will be taking this Y box test. And now let us come to the case study. Okay. So in case study, what we will do is, the first one is we will fill up a detail about the democratic details of the client. Okay. For example, always we will use only a nickname. Okay. So here we are using Pavitra. Okay. So the problem which she is having is OCD. Okay. Her age is 27. Her phone number, just we are because we will not give the exact aspect, address. Place of living, she is living in urban. Socio-economic status, she is upper middle class. Referral details, social media. Marital status, she is in a relationship, female. Next. Occupation, she is a IT professional. Just now she got work. She has completed her BTech. Religion, Hindu. Mother tongue, Malayalam. This happened in online at Ambattur. Something. Now, please mute your calls, team. Okay. So always that will be very nice. You mute the calls. Okay, we have filled up. Now we will go to the actual case study form. One second. So first we will fill all this information based on the details we are getting from the client. So Pavitra OCD, it has come here. Okay. Now we are going to add the details. Okay. So whatever detail we have added here, it is available here. Now, probable issue of the client. So the probable issue of the client, always we will write it in a, we will write it short. Okay. So the issue of the client is feeling that the hand got contaminated by others' touch. This problem it occurred only after Corona. So after Corona, she stopped touching others, even family members, including parents, and she has become ultra vigilant, and reduced social activities. So now this is what the probable issues. Okay. Now the presenting complaints we will write in depth. So the presenting complaint is number 1, obsession on washing hands 10 to 12 times. If she comes into contact with anybody or any outside aspects. That is number 1. And the second aspect is she doesn't want to go to college, reduced social activities. That is, she used to play basketball. Now she has stopped playing basketball. The duration is problem is after Corona, but it is very much felt in the last 2 years. Now here you will be always having mode of onset, abrupt, acute, subacute, insidious, and not able to identify. See, abrupt means it comes suddenly. Okay. Insidious means regularly. Now here it is insidious. Course type is continuous. So you will be having continuous, episodic, fluctuating, and not able to identify. Now, for example, how many of you know, for example, in the case study, there are 4 aspects: abrupt, acute, subacute, insidious. The exact meaning of this, how many of you know? If you know, please put K. If you do not know, please put D. If you know what is the meaning of all these aspects, if you know where to fill acute, where to fill up subacute, where you have to put subacute. If you know, please put K. If you do not know, please put D. Okay. Okay. Actually, we have prepared a very in-depth presentation on this. That is where you have to prepare, where you have to put what. Okay. I will share my number after this session. Okay. Message me. I will share with you the complete file. Okay. The complete file I will show you once. Because all those things I cannot explain now because the time will be more. Okay. So the case study format, how to fill up. So we have prepared a very lengthy one. Okay, as far as claustrophobia is concerned, there are 41 pages. So I will tell my number. Okay. You can message me after the program. I will share. Not today night, tomorrow only. Okay. What is this D? Kashi, I asked you a question whether you know it or you do not know. So for that they have mentioned the D. D means do not. So 1 second. So here, actually abrupt means suddenly it comes. It's very sudden. And acute means the intensity is more. It is not abruptly coming, but whenever comes, it comes in a frequent way, but the problem is very acute. Subacute is half of the acute. Insidious means irregular. So insidious. Course type is fluctuating means like this. Fluctuating. Today it is more, then increases, then downs, then increases. Okay. So continuous means continuous. Okay. Episodic means also continuous. But in episodic, maybe continuous and also it is progressive. So here nature is not static, it is progressive. Precipitating factor here is multiple causes. Multiple causes. So what are the multiple causes? The multiple causes are, one is corona, the corona aspects. Two, bereavement, because from our family, 3 people died out of corona. So that is one thing which triggers her. So predisposing factor, it has nothing to do with the genetic, but it is more to do with personality. So history of presenting illness. So this is what presenting complaints. Okay. So history of presenting illness, 2 years means how it started, how everything started. Okay. So the same thing we will write it with a little bit. We will explain it more. That is 1.5 year before it started with a low intensity. She started to take so much extra vigilant on all these aspects, and she stopped touching the utensils, etc. Slowly we started getting complaints from the neighbors and also from the college that she's not sitting with others, and she's not giving the books for even for correction. So all these aspects, and it is also she also carries a what do you call disinfectant. There's a disinfectant that she uses more. That is when she goes and sits in the college, the table, the complete table she will disinfect. Then only she will sit, and she will disinfect her hands, etc. So this disinfection behavior became more, and at some point of time, even she stopped touching mother. So that was growing in that space, because fearing that they may have corona and she will also get it. And this problem is even now it is continuing. Even now she is wearing mask. Wearing mask may not be an issue, but wearing mask may not be that much a big issue. But being over vigilant is a problem. Now social functioning is impaired because she stopped going to the social functioning. Occupational, she is not working, she is studying, but that is also impaired. She is not having any medical history. So psychiatric history, she was not having anything. So we can just put the tick mark. It is not applicable. Family history, it is a nuclear, and she is not married, not yet married, and the expressed emotion is hostility, because she's not moving with anyone. Psychiatrist illness in family, no. And it is not applicable because nobody was suffering. Birth and development, in this case, it is not required. So anywhere in case study, if it is heredity, then birth and development, we should write it. Here in this case, it is not required. So I'm just putting the tick mark. So educational history, she is doing B.Tech, third year. Not going to college properly, not attended one session itself. One complete semester she has not attended one complete semester. There are complaints from the college about her behavior. Occupational history, she is not working anywhere. She is only studying. Okay. So here we can write her the behavior with reference to the studies. Okay. So actually occupational history, it is not applicable. So student studies, we have written it here. Menstrual history, she attained when she was 16 and it is regular. Mood disturbance, no. Premenstrual mood disturbance, no. And mood disturbance at present, also no. Marital history, it is not applicable. Since she is not married, marital history is not applicable. And sexual history, it is not applicable because unmarried. And substance history, it is not applicable since she is not taking any kind of substance. So attitude to self is, she is over concerned. Attitude to work and responsibilities, perfectionist. Religious attitude, compliance. Social leader, she is an extrovert, introvert. Mood, she is having, she is irritable because of this compulsions and obsessions. Leisure time, she spends alone. So mental status examination. So she looks her age, level of grooming, overdressed. That is, she wants to wear more things so that she will not get contamination. Level of cleanliness, overtly clean. Mode of entry, came unwillingly. So actually she didn't come. The parents, they pressed her to come. Attitude, it was very defensive. She was not accepting that she is having the problem and she is not ready to accept that it is not good for her future. Eye-to-eye contact, accent, it was difficult, but she was having. Hallucinatory behavior, absent. Gesturing and posturing, normal. Gait disturbance, normal. Psychomotor activity is also normal. Speech initiation, it was normal. Reaction time, normal. Tempo, normal. Volume also normal. Tone, normal. She was able to speak coherently and she spoke relevantly. And speech sample not that because here it is not required. So mood effect, her mood is a little bit always looked like anxious because of this fact. Here she looked suspicious that others may carry corona and I will also get it. Range and reactivity normal. Appropriateness is appropriate. Thought. Her thought is she was having a little bit of retarded thinking because she's not able to accept her issues. Thought insertion, thought withdrawal, thought broadcasting. It was not available. It was normal. Obsession. So she is having thoughts. She is having thoughts, and compulsion also. She is having thoughts. Content. The content is overvalued ideas. Yes, she is having overvalued ideas. That is, she is having. Sometimes she is having even guilt feeling, thinking that she is not able to maintain cleanliness. She is having the suspiciousness and ruminations. Delusion systemized, no delusions. Delusion systemized, well. And perceptions, auditory perceptions, no. Other hallucinations, no. Here, no. Other hallucinations. OPD, no OPD. Higher mental functions, it is normally aroused. Orientation, oriented. Judgment, intact. Social judgment, a little bit impaired. Personal judgment, intact, but takes more care. Textual judgment, intact. Insight. So she is not accepting her problem. That doing like this, it's not correct. That is, she is not total accepting. So she is completely in a denial mode. Knowledge about the illness inadequate. Attitude towards illness and treatment is hostile. Risk to self, no. So level of risk, no. Low. Risk to others, no. Low. And property, no. And low. Here it is not applicable. So intervention on the first session. Okay. So intervention on the first session. So is it visible? Is it visible?
Yes,
Is it visible? Yeah. So can anyone read this?
So which one, sir? Intervention first session?
Yeah, first session. Yeah.
Sir, but nothing is written there. If not applicable, details of the first session, and then it is blank.
No. I am not showing it. Is it there now?
Yes, sir. Yes, sir.
Yeah.
Shall I, sir?
Yeah.
Session 1, Introduction to CBT, Psychoeducation and Cognitive Restructuring. In the first session, the focus is on building rapport and introducing the client to the CBT model as it applies to OCD. Begin with psychoeducation to help the client understand the OCD cycle, how intrusive obsessions lead to anxiety, which then triggers compulsive behaviors, providing only temporary relief. Explain how this cycle reinforces OCD over time. Using cognitive restructuring techniques, guide the client through identifying automatic negative thoughts, such as, if I don't wash my hands, I'll get sick or infect others. Engage in Socratic dialogue to gently challenge these thoughts by asking questions like, what evidence do you have for this belief? Or how often have you actually fallen in when skipping the hand wash? Introduce the thought record sheet to help the client document daily triggers, associated thoughts, emotions, behaviors, and healthier alternative thoughts. For homework, instruct the client to maintain a thought diary throughout the week, noting each instance of hand washing along with the thoughts and emotions that accompanied it. This helps in creating awareness and prepares for further cognitive work in upcoming sessions.
So this is first session. I will I will explain this. So one second. So this is what intervention on the first session. I'm just pasting it. Just I will submit this paper. Then we will see the session 1, session 2, session 3 in depth. We will see. Session 1, session 2. One second. Session 2. Just I will session 3. Session 3. Session 3 and session 4. So up to total 4 sessions we had and completed the procedure. And she also got a relief, and relapse prevention was not happening. Okay. One second. So team, this is the record. So this is a record. So we will discuss about the first day, second day, third day, fourth day. We will discuss. Okay. I have just put it here and save changes. Okay. So Pavitra. So I'm just downloading the PDF. So the PDF has come. So this is the PDF. So probable issue of the client and complete client details. Okay. So whatever we fill up, for example, expressed emotion, hostility. What are the things available and what is it? And so this is not required. So we didn't fill it. But then development, nothing is there because we didn't fill it because it is not applicable. And then finally, whatever even sexual history, since she is not married, it is not applicable. And mental status examination and mood effect, content, everything is available here. And session 1, what we did, session 2, session 3, and session 4, whatever we did. So this online format we have prepared in EmoCare, and whenever we do any kind of cases, we fill up this. Now, the 4 sessions. So the first session, what we will do is a rapport building. First, a rapport building. After building the rapport, we will try to assess the individual through box, and we will try to understand. So they may be telling she is having this problem. Then we will give the questionnaire. We will try to understand what is the problem and what is the intensity, obsessions and compulsions. Then we will psycho-educate the client. For example, for OCD, always a CBT, and CBT is very, very effective. And exposure response therapy from CBT, that is also very, very useful. So in the first session, we will psycho-educate the client about the basics of CBT. So what are the basics of CBT? Can anybody tell? What are the basics of CBT? Can anybody tell?
Can I?
Yes. Yes, Steve.
Identifying maladaptive patterns. and problem solving and learning to manage the thoughts and the connection between thought, feeling, and behavior. These four are the core techniques, and when it is in common, thought, cognitive, exposure, and relaxation comes, sir.
See, Afifa, sir, we write earlier that she is an IT professional in that work area. Yeah. Actually, she is studying in third year. We didn't write it because occupational history, it is a part-time work. We didn't write it. Afifa didn't understand the question. So, Afifa, the question is CBT, cognitive behavior therapy. Okay. We have to psycho-educate the client. We have to psycho-educate the client. Unless and until we psycho-educate the client on CBT, we cannot do counseling. So one of the principle of CBT is psycho-education. CBT will not be, we will not be able to give CBT to a person who is not able to understand the premise of the therapy. So in CBT, as Rahul Karthik told, we will psycho-educate the client about the basic cognitive model, that is, the thought only creates the reactions and not the situation, number one. Number two is, we will psycho-educate the client about the cross-sectional model. That is, the first time thought creates affective behavior and affective, somatic and behavior. These three things are created first because of the thought. But in the subsequent period, anything can create anything. Because when you see the snake, now you don't get the thought first. Immediately you start running, behavior. When you are running, you get fear. When you are getting fear, you got sweating. So anything can trigger anything. That is cross-sectional model. And then we will try to psycho-educate the cognitive, negative cognitive triad. We will give. Then thought record sheet, we will train the client so that whenever the thought comes, what is, we will psycho-educate them. Your thought is coming. What is the thought? What is the affective? What is the somatic? And what is the behavior? And what is the alternative thought? And what will be the alternate behavior? So in this case, actually, she was not agreeing that this was this is not a problem. Then here we have to do psycho-education on why it is a problem. So we made her understood through the box profile, and also psycho-education about OCD. Even we have to psycho-educate the client about OCD. Unless and until we psycho-educate the client may not know that she is having this problem. So only after psycho-educating, she was able to understand. Then we trained her on 1 minute mindfulness and the distraction technique. Distraction technique is, for example, a simple distraction technique is just holding the band here. Okay, just removing the band and snapping it. So when we snap, she comes to the awareness. When a person comes to awareness, they may not repeat the behavior. So OCD, when people are involved in that behavior, most of the time that is unconscious. They are not consciously involving in it. So bringing them to normalcy. So this was done in the first session. So Afifa, is it understood? Afifa, is it understood? Afifa, any doubt? Afifa, can you just put in the chat box? Acha, okay. So we will see the second session. So in the second session, that is exposure and response prevention. Yeah, Sakshi, can you read it?
Yes, sir. CBT, Exposure and Response Prevention, ERP. In the second session, the focus shifts to behavioral intervention through exposure and response prevention, ERP, a core technique in treating OCD. Begin by collaboratively creating a fear hierarchy, listing contamination related issues from least to most anxiety provoking. For example, touching a doorknob without washing versus not cleaning her phone for an entire day.
So your list is prepared. Your list is prepared. Suppose, for example, touching, whenever she touches something, she feels that it is contaminated and she goes and washing the hands and she doesn't touch. So what are the aspects she gets more, what do you call, fear? So in this case, she was getting more fear on kitchen utensils. Kitchen utensils. So what she used to do it, she will eat. She uses a separate tumbler, a separate plate for eating. Okay. So after eating, she will wash it, and she will take it and she will keep it in the air room. She will not keep it in the kitchen. Again, the next day she will bring it, because there she has more, because she thought that she got corona because of the family members. And through family members it came, because that would have been passed from the kitchen. So there she was having more, but mobile phone she was not having that much. Even though she's putting a charge, she's putting a charge in the front room, she doesn't watch the mobile phone. So fear, wherever she's having more fear, that is being listed, and then appropriately exposing the person. We will expose to the least one first, then slowly we will go into the hierarchy. Yeah. Yes.
Introduce ERP by selecting a mild item from the hierarchy and guiding the client to face the feared situation. Example, touching a slightly contaminated object, while deliberately delaying the compulsive response, such as hand washing, for at least 1 minute. Emphasize the importance of staying with the discomfort and resisting the urge to perform the compulsion, as this is the key to weakening the OCD cycle.
So here what we will do is, we asked her to keep the utensil in the kitchen and eat. So she will take the tumbler to her room and wash it and keep it. So she will keep that tumbler 30 minutes before, then 1 hour, then 2 hours, then 3 hours, slowly increasing. Once it is beyond 2 hours, we asked her to keep it in the kitchen itself. So slowly exposing. Yeah.
Reinforce the principle that anxiety will naturally decrease over time with repeated resisted exposures. For homework, instruct the client to practice 1 or 2 exposures task daily from her hierarchy and record the experiences, including emotional responses, to track progress and build tolerance to anxiety.
So all these things will be done in the thought record sheet. So in thought record sheet, you have 4 lines, 5 lines, 7 lines, 8 column. That is 4 column, 5 column, 6 column, and 7 column and 8 column. Thought record sheet is there. So any one record sheet which may be useful for the client, we will be using it. Yeah. So the third session.
Yeah. Introducing REBT, identifying and challenging irrational beliefs. In the third session, rational emotive behavior therapy, REBT, is introduced to help the client recognize and challenge the irrational beliefs underlying her OCD.
So here what we will do is, here what we will do is A, B, C, D, E. A stands for activating event. So I want to mother is there. I want to touch my mother. That is the activating event. The belief is I will get corona. The belief she is having it. I must not touch my mother, because if I touch my mother, I will get corona. So B is called irrational belief. Every irrational belief will have must, should statement will be there. C is consequence. She is not touching mother. Now we will dispute. Here in dispute, what we will do is, okay, you are having a younger sister. Your younger sister is touching the mother. Whether she is getting corona, whether she got corona, no. Whether the husband is touching the wife every day. Whether the husband is getting corona now, no. Corona, you have taken the injection, and the sign says it will not get repeated. So all these dispute we will do by disputing A, B, C, D. D is dispute, and E is empower the client with a new belief. So A, activating event, B, irrational belief, C is a consequence, D is dispute, E is empower the client with a new belief. So that we will do it in the third session, and in the fourth session, doing both, combining both CBT and REBT. This is what we call it as integrative therapy or eclectic counseling. So when we combine CBT and REBT, the output is more. So the exposure and prevention therapy is also being done. At the same time, we also try to understand our core belief, the negative core belief, and try to change it into the positive core belief. In session 5, we introduce hypnotherapy. Yes. So CBT and REBT, it is mostly for the brain. But even in our mind, it might have got penetrated. So in the 5th session, we give a hypnotherapy, the complete script I have given. The complete script I have given. So when we, for example, in hypnotherapy, what we will do is, every time you feel urge to wash unnecessary, you will pause. You will take a deep breath. I am already safe. So visualization. Now imagine yourself walking through your room. Everything is clean. You are walking, you are going and hugging your mother. Nothing is happening to you. So all these things we will do it when she is in the trance, and we will try to empower her with the new element. So in case study, all these aspects we will fix it. Okay. So team, thank you very much for joining in the Psytalk. If anybody wants the things, please message me in 996216312. Please message me, and please give me 2 days time, because tomorrow we are having 10 students are going to join in the program offline. So I'll be busy. So only tomorrow night or day after today morning, I will be able to send it. Okay. So group we will not share. Afifa, we will not share it in the group, because see, Joe, only the person who takes effort gets the biryani, isn't it? People who are not attending, now why I should share? Whoever has attended, please text to this number. I will share it with you people. The case study, whatever we have downloaded, and also a PPT. Okay. And other aspects, I will send it. Team, our 8 months diploma is going, and in 8 months diploma, we are training 40 therapists, and we are having very good discount month end. We are having very good discount. If anybody wants to join the 8 months program, kindly text me. You have a discount and also you have a chance to learn NLP. So 8 months program is going to start, and also NLP practitioner, NLP master practitioner and NLP coach. It is also going to start next month. If anybody wants to join, they can message me. The case study, we have created a 1-year case study program. In 1-year case study program, we will have a meeting twice in a month on case study. So next week we will be having about PTSD, but that is not on Psytalk. That's a paid session. So monthly twice we will have the session, and 15 days people will exchange the thoughts, ideas and techniques in the group. I will not do. The people. That is already we are having around 60 members we are having. So if anybody wants to join, that is only 1,999, 1-year program, and you will get a minimum 24 case studies you will get. And there we will little bit in-depth discussion will take place. And also you will get PPT about all these aspects. 1,999. If anybody wants to join, they can message to the same number 99616122. If at all you are very serious, join in our diploma. Definitely it will be very useful. Even Sakshi is a member. Sakshi, is it useful, Sakshi? The 8 months program?
Definitely, sir. For me, this diploma journey is life changing. For me and for also understanding others as well.
Very nice. See, nowadays counseling is increasing. Okay, counseling is increasing. I will tell only one thing and I will finish it. Okay. Yesterday, day before yesterday evening, 4 o'clock, I got a counseling, and what happened? I asked the internship. We are having an internship group. So in the internship group, I asked whether anybody is ready to join. Okay. Then one girl joined. Okay. Madhumita, she joined the session along with me. So the client is MA English Literature, MA English Literature, MPhil, and MN. The problem is she has developed a relationship with a student who is just 18 years old. And she wants to come out of it. For that, she came for counseling. Now, the thing is, why I am telling this here, nowadays counseling is increasing. Even today itself, I did 2 counseling I did. Okay. Training and also counseling. We are getting many requests. Tomorrow I have 4 counselings. Counseling nowadays, it is increasing. So whoever are psychologists, kindly use it. And if you have not applied for licensing, apply immediately. Whoever is in India, if you have not applied for what you call licensing, apply immediately. If you are having MSc, apply immediately. Okay. So thank you very much, team. Bye bye. If anybody wants to 8 months or